Hello, my name is Brooklyn Hearn, and for my research presentation topic, I chose to do the genetic disease Hutchinson-Gilford progeria, named after the two gentlemen who first discovered it back in the 1900s, but people normally just call it progeria. So what it is a rare disease that causes rapid aging in children. It's not hereditary, so you cannot inherit it from your parents or grandparents. It's just a mutation that randomly happens in the LMNA gene. So what happens cellularly with a healthy patient and their cells is the LMNA gene produces a lamin A protein, which structurally holds the nucleus of a cell together. And that's what we see on the right here with this cell. You can see the nuclear envelope is really intact, it's stable, how it's supposed to be. But in a patient with progeria, the lamin A protein produces something called progerin, and that makes the nucleus unstable, which we see the nuclear envelope here is sort of disheveled, disruptive. It's not really stable. Some facts about the disease: because it's extremely rare, it only affects 1 in every 4 million children. When I was doing the research for this, I didn't see any cases of 200. So there's less than, I think, even 170 cases of this around the world. So it's super rare. The oldest person to have lived from it was 26 years old, which that's super amazing because most people don't live past 13, 14 years old. So that's amazing to hear that person lived to be 26. And then something I thought was super interesting was the disease does not hinder the child's intellectual ability. So what this means is that normally genetic diseases that we see, like autism or anything like that, the child acts and is mentally incapable of acting like their age. So we would see like an 8-year-old having the mind of a 4-year-old, or scenarios like that. But with progeria, a 7-year-old who has the symptoms is showing progeria, acts just like a 7-year-old should intellectually. So that's pretty cool. Some signs and symptoms of the disease: we do see alopecia, swollen veins in the head a lot, shrunken in chin, a smaller beak-shaped nose, not a lot of body fat, osteoporosis, swollen and stiff joints. Arthritis is a big problem they have, which, let's go back to this picture here, and we can see some of these things like the swollen veins in the head. We also see in this little baby that it has not a lot of hair from the alopecia. This little baby does not have any. None of these children have eyebrows, eyelashes, because it's harder for them to produce it because they are older. In this little girl's, you can see the sunken in chin, the little nose. And doctors diagnose this just off of what they see, because you can physically just tell when a patient has this. If you don't want to just go off of physical attractions, you can get genetic testing done and you can look for the mutated LMNA gene. So the prognosis for this disease: people typically don't live past their 20s, but there have been a couple who have. And then treatment, it's not curable right now. There hasn't been a lot of research done on it, but patients do take medications like zoledronic acid for the bone growth, because they are older in a sense. They do have to take some steroidal type of drugs to keep their body as much as normal as they can. They do wear hearing aids because of the aging deficiency. Their hearing goes out just like any other elderly person's would. And then physical therapy, because of their swollen and stiff joints, it helps them be a little more mobile. And I believe that's it. So thank y'all. Here's my references.